They've been called COVID hotspots.
The 168-year-old prison saw roughly 75% of its inmate population infected with the virus.
As many as 1 in 3 incarcerated people in this country's prisons and jails have been infected with the coronavirus.
For those behind bars during the coronavirus emergency, social distancing has all but impossible.
We'll explore how the vaccine is being viewed by incarcerated people and correctional officers.
All of the sort of 400 or so correctional officers who responded to that poll said hell no, right? Not even just no, but hell no.
We'll bring you a first-hand account of one person's experience battling this deadly pandemic inside a crowded prison.
I contracted COVID twice while I was incarcerated.
And we'll dig into some of the myths that have taken root about the virus and the vaccine behind bars.
People are really worried. They say, is it going to change my DNA?
All that and more on this episode of Inside Story. I'm Lawrence Bartley, the host of Inside Story. Unfortunately, I was incarcerated for 27 years, but since my release, I've been working with the Marshall Project, covering criminal justice. It is our mission here at Inside Story to bring you in-depth coverage of the criminal justice issues that matter most to you. We're happy you're joining us as we explore COVID's deadly impact inside this country's prisons and jails. There are few people who covered the subject of COVID in prisons more deeply than Nicole Lewis, staff writer for the Marshall Project. We begin with her. Nicole, thank you for joining us. You recently conducted a survey of incarcerated people focusing on the COVID-19 vaccine. What did you find?
We kicked off the survey because we really wanted to know if incarcerated people had questions about the vaccine, were hesitant about the vaccine. And what it looks like is that the majority of people who responded are actually interested in getting vaccinated. This year in prison, under lockdown, during the pandemic has been so difficult for people that they see the vaccination as a potential opportunity to get back to their normal lives and their normal programming.
Can you tell me what those numbers are like, the percentages of people who will take it as opposed to who won't?
So we heard from about 140 people spread out across, numerous states. And the majority of them said that they would get vaccinated when their time comes. So that leaves about another 40% who said, I'm not sure.
Your reporting also looked at the mistrust that exists between incarcerated people and prison officials. What did you learn? Prisons
are notorious for their subpar medical care. Right? There are numerous lawsuits in many state prisons about just a lack of treatment. And so many of the incarcerated people made very clear that they, based on their experiences, just simply do not trust the prison medical staff.
I know you also picked up on some of the suspicions incarcerated people have about the vaccine, that the shots are part of some broader medical experiment. What can you tell us about that?
In my reporting, I highlighted a research effort from the University of Washington that used male prisoners, as sort of lab rats to sort of understand how radiation affected human reproduction. And so there's a sort of natural question or inclination to say, wait a minute, is this part of the history of experimentation that we've seen here, right? Are we somehow going to be used as test subjects to then, develop and determine and make a better vaccine for the general population?
Given all that, I imagine some prison administrators had to get creative to encourage people to take the vaccine. In your reporting, you singled out Rhode Island. Tell us why.
Sure. So Rhode Island, they were actually able to go cell to cell and really ask people, do you want this vaccine? Will you take it? And what are your questions? And it meant that they were pretty successful. It's looking like about 75% of the incarcerated population is inoculated already in Rhode Island.
Well, we know the pandemic will never be contained by a prison wall, and correction officers come and go from prisons and jails every day. So I was interested that your reporting found some prison staff are reluctant to get the vaccine.
I kept hearing from a number of people that guards and correctional officers were telling them that that they weren't going to take it. And so I said, well, this probably bears further reporting, right? And when I looked more into it, what we found was that numerous correctional officers were just simply not interested in getting vaccinated, that they were declining in pretty high and pretty alarming rates. And so we just have big questions about how could it be that the very people who've been working in these prisons, who've been eyewitnesses to the outbreak behind bars, are suddenly not interested in this vaccine.
Yeah, and I think I remember in your reporting you mentioned that in Florida there was some type of unofficial poll taken by a correctional officer. Is that true?
That's right. So we were able to see a poll that was taken in a Facebook group for Florida correctional officers. And, you know, the majority, right, almost all of the sort of 400 or so correctional officers who responded to that poll said hell no, right? Not even just no, but hell no, they're not getting vaccinated.
How is that affecting people who are incarcerated? Whereas if the guards don't take it, isn't that sending the wrong message to incarcerated people who are considering taking the vaccine?
You and I both know prisons are a place where it is really difficult, right? Hard to do your own research unless you have a family member that you're in touch with or a loved one or somebody who can help you get your questions answered. And so can you imagine if you are incarcerated, you're trying to figure out what to do. Maybe someone you know has had COVID behind bars. Maybe you have even had COVID behind bars. And you're thinking, goodness, they're about to offer me this vaccine and I need to know more. I want to know if I should take it. Now, imagine if a series of COs comes to you and says, well, I'm not taking it. You know, people have died. It's dangerous. There are side effects. It could kill you. It has microchips in it. It might be really difficult to make the decision that is best for your own health and safety, right? It might be that you're kind of swayed or too concerned or too alarmed and just simply do not have enough factual, fact-based information to counter their points.
As they say, information is power, and that certainly applies to this pandemic. Thank you so much for joining us, Nicole.
Anytime. Good to be with you.
And now we're going to turn to Jermaine Archer. Jermaine was incarcerated at 2 northern New York prisons, and he was one of the 400,000 incarcerated people to have been infected with the coronavirus over the past year. All right, Jermaine, take me inside the prison walls with you and tell me what it was like living with the threat of the pandemic hanging over your head every day.
Living with the threat of the pandemic inside a prison facility was probably my most challenging time during my incarceration. I spent 22 years inside and it was just different because no one knew what was going on. The biggest concern was that no one could tell us what was going on because they didn't know what was going on and they were in charge with our health.
That lack of information must have added to your fears.
It just increased the danger in my sense. And I remember thinking, I made it through all these years. I got less than a year left. And now I'm dealing with Corona. I mean, it just became a much more hostile environment, much more dangerous environment.
I understand you contracted the coronavirus not once, but twice. How far apart?
6 months, almost exactly.
And the last time you came down with it, you were close to coming home?
I had 3 months to go to the parole board.
Do you remember the first moment when you knew you were sick?
The first time I realized I had COVID-19 was when I realized I couldn't smell anything and I couldn't smell the bleach. Then I realized this is not normal. There's something wrong. This is something I've never experienced before. So that's when I knew I was infected with COVID.
Did you find that there were some incarcerated people who hid their COVID symptoms?
A lot of people contracted it and experienced the same symptoms, but they didn't report it because they felt like they could take better care of themselves in their cage as opposed to being sent to a hospital and getting the standard 3 meals a day that the facility serves and no other type of treatment, just a waiting period.
So what about for you and those who did report that they have symptoms? I know you said there wasn't any treatment, but did the medical staff help you manage your symptoms at all?
There was no treatment, and the medical staff made it clear to us that they were confused. You know, the only thing they constantly told us was self-quarantine. They didn't have anything to suggest because they all kept saying, this is brand new to us too. This is something no one ever went through. We don't know. We don't know. They kept saying, we don't know. Nobody knows.
Did you find that correctional staff were taking the pandemic seriously, wearing masks and doing the things they need to?
There were some correctional officers and staff that were really serious about it. By the same token, there were many people who were not. There was a sergeant who delivered the masks to everyone in my dorm. He didn't have a mask or gloves on.
Okay, so let's talk about your incarcerated peers. I know it was talk that the vaccine was coming. So did you find that people incarcerated with you, that they would be eager to take the vaccine? Were they talking about it at all?
I want to say it's 50-50. I know several people that I spoke with who really want the vaccines, whether for health reasons or in order to reopen the visit room because they really miss their families. By the same token, I know several people who are against the vaccine because of past experiences that this country has had with incarcerated people and minority people that have been experimented on. So I know a lot of people that are really concerned about having anything injected into them because there's not enough data on what long-term side effects can result from the vaccine. So I know many people that are concerned.
So what would your message be for those running prisons and jails?
They need to really look into using correction law and reducing the prison population as much as they can through the mechanisms that are already in place. There are ways that a superintendent or warden of a facility can release someone temporarily or otherwise to the community based on the level of threat they pose to society or to the institution. And I'm sure through proper research, proper investigation, they can absolutely reduce the size of the prison population, allow people to social distance, because people that may want to social distance still find it difficult due to crowded facilities.
Jermaine, we'll end it there, but I want to thank you so much for your time and insights.
Thank you. Thanks for the opportunity.
Our next guest, Dr. Leah Rorvig, has heard all the rumors and myths about the coronavirus and the vaccine. Based in California, she works with men. Dr. Roarvig, thank you for joining us.
So happy to be here and so excited to speak about this incredibly important topic.
So can you tell me, for those who don't know, what is AMEN and what does AMEN do?
AMEN is an amazing organization. We are a correctional culture change organization working to improve the health of people who live and work in U.S. jails and prisons.
So let's get into it. Can you tell us how the vaccines work?
Yeah, so really when we think about the vaccine, we should think about two different categories. We have the Johnson & Johnson vaccine, and then we have the Moderna and Pfizer vaccines. The Moderna and Pfizer vaccines are both mRNA vaccines, which means when you get the shot, you get instructions about how to make a little protein on the outside of the COVID virus. That is what your body uses to identify it. All right. Now, the Johnson & Johnson vaccine uses another virus called an adenovirus also to introduce a little bit of the spike protein to your body so that your body reacts to this spike protein so that you'll be protected from COVID.
You've probably heard all the concerns surrounding these vaccines. Some people believe that they were created too quickly, they weren't fully vetted, or they will get them sick. So what do you say to them?
So one concern I hear a lot is that because the mRNA technology is new in terms of being used for a vaccine, people are really worried. They say, is it going to change my DNA? And to that question, I can give 100% reassurance. What you are getting is a tiny bit of mRNA. There is no possible way for it to interact with your DNA. It cannot change your DNA. There's no mechanism whereby that can happen. So I really like to reassure people your DNA is safe and will not be affected by the mRNA vaccine.
Are there any side effects?
I don't even like to use the term side effects because what we're seeing are really anticipated effects. So effects we expect to happen as a result from your immune system responding to the vaccine. So even though we say side effects, these are really anticipated effects of the body responding to the vaccine and getting ready to protect you if you're exposed to it in the future.
So if someone was to get either of the vaccines, can that person still spread the coronavirus?
We don't think that's likely, and we don't know for sure yet. So unfortunately, for now, even if you have the vaccine, you should go with the assumption that it's possible that you could potentially still spread it. That's one of the really difficult things about this virus and the vaccine is we're still not sure the answer to every single aspect of how it works.
If a person is vaccinated, can a person still contract COVID-19?
Yes, definitely. Even people who've been fully vaccinated can contract COVID-19 and can even get sick. If you recall, of the 3 vaccines, none of them are 100% effective. So absolutely, it is still possible to get COVID-19. Even though it's very unlikely, it is still possible.
What do you say to those incarcerated people that might be skeptical of prison officials and big companies? Is it realistic for them to watch the syringes be taken out of its sealed packaging and then draw up the vaccine before they allow it to be stuck into their arms?
It is realistic, I think, for many people. At a minimum, it's realistic to actually see the syringe drawn out of the vaccine vial, because in general, there's only about 5 doses of vaccine per vial. So if a lot of people are getting vaccinated at the same time, there's going to be a nurse or some other healthcare worker actually pulling up the doses, and people should be able to see that. However, it's very uncommon that you're going to be able to see the vial actually in its original packaging and come out of its packaging from the manufacturer, because that usually happens in a pharmacy or other controlled area.
Through our reporting, we've learned that correctional officers don't trust prison administrators as well. So therefore, they are also reluctant to take the vaccine. So is the men doing anything to try to educate correctional officers when it comes to the vaccine?
Sometimes when people are reluctant to get the vaccine, one thing I urge them to consider is that getting the vaccine isn't just for you. It's also to protect the other people who are around you. And what I sometimes ask people to do is think of the sickest person you know. For a lot of people, it could be a grandfather. For someone on the inside, it could be a particular person in their unit who's in a wheelchair, who's on oxygen. If you get the vaccine, it's not just to protect you, it's to protect that sicker person in a wheelchair on oxygen, because they are the person who actually is at risk of getting COVID-19 and getting so sick that they have really serious health consequences or even die. So try to keep that person in mind when you're making your decision about getting the vaccine.
Are incarcerated people receiving the same vaccines as correctional officers?
In general, the answer is basically any specific prison is offered one vaccine. For example, they say, look, you are getting your shipment of 3,000 Pfizer vaccines. Vaccinate everybody, including your staff and the residents.
So can you tell me, why do you believe it's important for incarcerated people to be vaccinated?
We have learned so much about the public health importance of what is happening in prisons and jails during the COVID-19 pandemic. I want to kind of think back to 6 months ago, looking at the data, we would know that literally of the top 20 largest outbreaks in the United States, all 20 were linked to either prisons or jails. So we know that huge outbreaks have happened at prisons and jails.
And those outbreaks obviously don't happen in a vacuum.
Those outbreaks affect the entire surrounding community. They affect the staff that are coming and going from the prison. They affect the hospital where these sick incarcerated people may have to be transferred if they get critically ill. In other words, what happens in a prison is absolutely going to affect the surrounding community. So if you want your community to be healthy, you really need to care about the health of the people living in the prison and make sure that COVID does not happen in the prison or the jail, or those people are going to be taking up a lot of spaces in your local hospital bed.
Just days after our interview with Dr. Roarvig, a joint statement was issued by the CDC and FDA recommending the U.S. pause the use of the Johnson & Johnson vaccine because of a blood clotting concern. We caught up with Dr. Roarvig to update us on this development. Dr. Roarvig, can you tell us what happened with the Johnson & Johnson vaccine?
So the US has a very careful monitoring system where they keep track of any possible side effects that are serious that could have happened as a result of the vaccine. And in the United States, thus far, almost 7 million doses of the Johnson & Johnson vaccine have been given out. Of those nearly 7 million doses, there have been 6 cases of younger women between the ages of 18 and 48, that have developed quite serious blood clots. It's a really kind of unusual type of blood clot. And one of them very sadly actually died as a result of this blood clot. And specifically, I want to say that these blood clots all occurred within just a couple of weeks of getting the Johnson & Johnson vaccine.
But can you tell us, why didn't all this come out during the trial phase?
Partly is that a trial is never going to find everything, right? So the trial was done on tens of thousands of people, the Johnson & Johnson vaccine. And as far as they were to determine, there was no serious side effects like this. However, now that this vaccine has been given to millions and millions of people, as I said, almost 7 million people in the United States, new things may arise, and in this case, they have. So I want to remind everybody that the Moderna and Pfizer vaccines at this point have literally been given to hundreds of millions of people with no events like this occurring. So they have a very clear record of safety. Nothing like this has ever happened with either of those other two vaccines.
Thank you, Dr. Roarvig. We certainly appreciate you.
So happy to be of help.
After a thorough review, on April 23rd, the CDC and the FDA lifted their recommended pause on the Johnson & Johnson COVID-19 vaccine, stating they have confidence in both its safety and effectiveness. The pandemic hit the criminal justice system hard like the parole board. According to our COVID tracker, nearly 500,000 people working and living in prisons have contracted the virus, of which over 2,700 have died. Some states are slow or are pump faking with the vaccine, while others are catching heat for prioritizing prisons. But what stands out the most is the fickleness of trust. Meritless conspiracy theories aside, news of serious side effects and every instance of racial tension, from police and community relations, border politics, misplaced Asian blame, and other personal experiences, exacerbates the mistrust that is playing out in vaccine hesitancy. In issue 6 of News Inside, there is a section called The World Outside. In it, an incarcerated man named James writes about what he sees through his window. He said, "I see the wall to the clinic where old men who aren't fortunate enough to ever leave this place go to take their last breath. Every week I see the ambulance pull up to that clinic, and I wonder if another old soul left this world." When I read that, I thought, I wonder how many old souls succumbed to COVID-19. And for those who did, how many would have inoculated for one last shot at life? There's an old saying, stay ready so you don't have to get ready. It's essentially a way to move into position to take advantage of opportunities. Choosing to take the vaccine applies here, since it obviously provides an opportunity to stay alive. But what about the choice to not vaccinate? And why does it feel dirty to exercise it when choice is a subset of freedom and arguably a natural, non-regulated right like the one to breathe air? I'll tell you why. Because if a person isn't living responsibly, exercising that option can be harmful to others. Either way, it's my job to provide you with the information to help you decide. Because as Madeline L'Engle once said, to take away a person's freedom of choice, even the freedom to make the wrong choice, is to manipulate as if they, she, or he is not a person, and I would never do that. My name is Lawrence Bartley, and this has been Inside Story.